Thanks for watching The Source Special Report, COVID-19 Niagara Update. And joining me on the line right now, Tina Hoenselaar from Canadian Blood Services. With the effect that this coronavirus has had on the health system and the worries about the overtaxing of that system, one of the things that we need to be concerned about is having enough blood to support that health system. And Tina, you can talk about that. You are encouraging people that it's still safe to give blood during this crisis.
Hi there. Thank you for having me. Absolutely. We're trying to really get out the message to all of our healthy, eligible donors that making those appointments and keeping those appointments is extremely important. Our centers are a place of wellness within the Canadian health system. We have robust cleaning and infection control practices in place at all of our centers that protect all of our donors, staff, and volunteers. Only healthy people are eligible to donate blood as well. And we just want to make sure that everybody knows that the need for blood is constant, and throughout everything that's happening, there are still patients who are undergoing surgery and cancer treatments. There are still going to be car accidents and people that rely on those blood transfusions every day.
How has the inventory been holding up on a national basis so far?
So the inventory is currently strong, and since our Prime Minister announced the need for blood and that constant need is still there, we've actually seen great results across the country of people that are healthy still coming out to donate, which is great to see. We just hope that that continues.
How can people get in touch, and how can they actually move forward to donate blood?
Yes, that's a great question. So we are currently asking people to either go to www.blood.ca to book their appointments, as well as download the Give Blood app to sign up to donate.
Has there been a drop since this virus has taken hold? Has there been a drop in donations?
So there has definitely been a big spike in appointment cancellations that we have seen as soon as things started to happen around the country. But again, since then, we have seen our amazing donors come out and continue to donate blood, which is great.
You mentioned the cleaning process, the cleanliness of the blood clinics. What about the social distancing aspect, and how is that handled?
Yeah, that's a great question. So all of our clinics are currently following all instructions to keep our social distancing, as well as no social gatherings above 50 people. So that is something that our staff has put into place. A couple clinics have mentioned donors waiting outside. We have all of the beds and everything is cleaned down between each donor, and it seems to be working really well.
A question about the blood that's donated here in Niagara. Does all of that inventory of blood stay here in Niagara, or does it end up elsewhere?
No, that ends up elsewhere. So all of our blood gets sent to a lab, and then from there it is sent out to hospitals based on their needs.
That makes perfect sense. Thank you for joining us. And again, can you tell us one more time how someone can move forward to donate blood?
Yes, so we encourage people to download the Give Blood app, or you can visit www.blood.ca.
Thank you very much, Tina. Tina Hoenselaar from Canadian Blood Services, urging everybody who is healthy to please consider donating blood even during this COVID-19 crisis. You're watching the COVID-19 Niagara Update on your TV, The Source. I'm Mike Balsam. We'll be back in a moment.